Awesome. Thank you. Good afternoon, everyone. Thank you for joining us for the town hall today. My name is Ken Kettenbiel. I'm the Vice Chancellor for External Relations, and here with other senior leaders that will give updates here shortly, and then we'll entertain questions at the end. We have about 280 people that have registered for this town hall, so a little bit lower attendance than in town halls past, but we're on campus. Teaching is taking place in person, and I'm sure many people will watch this recorded version once we are completed. I do want to recognize, I understand there was a two-step process for registration this time. For those of you that may or may not know, our assistant Maria Cheatham left the university in August. Clearly, she knew what she was doing. I don't. So we had something checked wrong on the registration process here. So I'm glad everyone's in. I sent an email out to those that registered. We'll get that corrected next time. So the purpose of today's town hall is to talk about observations from the first couple of weeks of classes, to see how the vaccine policy compliance is working out on campus, talk a little bit about face covering compliance, and then again, just overall observations from people on the ground, the chancellor, the provost, as to what's been taking place on campus, to see if the plan that we had put in place in August is working the way it should. If you have any questions, please use the Q&A tab along the bottom. Don't use chat. We're going to look at the Q&A tab. And for those of you that have submitted questions in advance, we'll get to those first out of the gate. And I also don't want to wait to the end on this because I forgot to mention this last time, but Kamal and Anitra from ITS are going to serve as the backbone and make sure this 1-hour webinar works. So thank you both for your support on this. Thank you again at the end. So with that, I'm going to throw it over to Chancellor Grasso to kick us off, and then I'll quickly go to other panelists. And I mentioned most of this will be Q&A today. So Chancellor Grasso.
Thanks very much, Ken. And first, I'd like to start by, again, thanking everyone for everything that you've done to get us to this point and to make the last 18 months as safe as they have been and hopefully will continue to be. I'd like to acknowledge that, of course, today is Yom Kippur, the holiest day in Judaism, and Gemar Hatama Tova is the appropriate greeting for this very holy holiday. I'd like to just start by sharing some of my observations of walking around campus in the last couple of weeks. One of the things that I have noticed is a distinct uptick in enthusiasm on campus with everybody that I've been talking to. And I think it's a result of the fact that a lot of planning went into bringing everyone back to campus, and people feel safe. We thought about a lot of protocols, we instituted them, we've followed up. I have the best team in Michigan, probably in the United States, in pulling this all together. And just this morning, we were speaking with Dan Hurley, president of MASU, the Michigan Association of State Universities. And I told him that there was no such thing as perfection, but we are as close as you can get. And if he's doing any public announcements or press releases or speaking to the press, that we would be a fine example of how to navigate this terrible situation of the COVID pandemic. We have taken care to keep everyone safe and to make sure that we can accommodate everyone's medical and religious preferences through this time here. Right now, our faculty are 85% overall vaccinated. Tenure and tenure track faculty, 95% vaccinated. Staff, 87% vaccinated. Later in the presentation, Amy will talk a little bit about where our students sit in vaccination, which we can also be very proud of. 80% of our students have a face-to-face on-campus experience this semester. So the majority of them are spending some time on our campus, and they're doing it very safely. I think that this has really started off in a very positive way. And I know that some of our sister campuses, either across the state or across the nation, have not been as fortunate as we have been. But I think, again, it's due to all the hard work of the staff, the faculty, and the compliance of our students and faculty and staff with our protocols. And I have to give them a great deal of credit. We've got a terrific group of students that are coming to school here, and they understand the importance of keeping not only themselves safe, but everyone else around them safe as well. So I hope that we continue down the same path that we started for the rest of the semester. We're doing everything to the best of our abilities, but in addition to that, we're also keeping our fingers crossed as well, and our toes crossed. So of course, we don't know what curveballs are going to be thrown at us, but as I've said many times before, luck is when preparation meets opportunity, and I can tell you that we are well prepared. So as long as we don't have a twist that we have not foreseen, we will keep everyone safe for the rest of the semester and continue to do the best we can. So I'll turn it over back to Ken. I want to thank all of you again. I want to especially thank my senior staff and deans, and thank all of you for helping us keep our campus safe and productive. Ken?
Thank you, Domenico. Gabriella, if you wanted to share a little bit about your observations. I know you've working closely with the deans as to what is happening at the college level. And then one of the questions that we received, and I know you're on it, is what does winter look like? Which I always puts a smile on my face because it's still summer, but I know planning has already started for the next semester. So go ahead and get Gabriella.
Well, thank you, Ken, and thanks everybody on this panel, but thank you everybody for joining us. I want to thank really everybody for all of your efforts in keeping our campus safe and for encouraging our students to comply with our vaccine and mask mandate. This is very important that we continue to do that in our classrooms. I have to say that the deans last week, 2 weeks ago, reported that all went well during the first week of classes. The buildings were staffed with very courteous screeners. We have so many screeners to thank who were there from 8 a.m. to 9 p.m. every day. So that was wonderful. And the team that staffed the screeners, obviously, and students got a lot of help in downloading their Responsive Blue app, in getting to the right screen, in uploading their vaccine. So that went very well, and it helped the students move through the buildings very quickly and smoothly. I was very concerned about that there would be a long line, and it didn't happen. And I heard this from all 4 deans as well. I too, just like the chancellor said, in walking around campus, I met very enthusiastic students, introduced myself. They were so happy to be back. And same thing for some colleagues. They were just so happy to be back and also reported no issue. So I remain very optimistic about a good semester. I think that we have a good structure to keep us all safe for the whole semester. And this is how I'm going to remain very optimistic. Like Ken said, as you know, we're already planning for the winter schedule. I think it's due in about 2 weeks. I know you're all working on that. Thank you for that. I really do hope that we can deliver 60% schedule of on-campus courses, because in listening to our students, they want to be back for the great majority, especially in our first and second year students who have been home for so long. This is it. Please feel free to reach out to me. I am sorry I keep bombarding you with emails every day, but we want to communicate. We want to make sure that you are up to date with what's going on, the number, the exemption requests, and what happens in your classes. So again, a big in big gratitude. Thank you.
Thank you. Okay, next I'll throw it over to our Dean of Students, Amy, and I know you have a lot of, Amy Finley, I'm sorry, you have a lot of great news to share on where we stand with the compliance issues with the policy, from the student side, and I'll throw it over to you quickly to share some, continue the positive news.
So I just want to say that I echo the optimism that both the chancellor and the provost have mentioned. And I also want to say that I think I'm rubbing off on people, because I have been optimistic from day one. And I think people are starting to believe me, so that feels really good. It has been a wonderful few weeks. We started out the day before classes started with Wolverine Welcome Day, bringing 800 students onto our campus safely in person so that they could get to engage with faculty and staff, meet some of their peers. It was a really fantastic day, and it was a great kickoff to the year. A week later, we had what I think may be the most successful student organization fair we've ever had. We had just less than 100 departments and organizations participate, but what was so clear was the students' desire to get engaged. And so it's, in some ways, it's a reset to our student life, right? Because people have been at home for so long and they are really anxious to engage, and we're taking advantage of that opportunity. So I think what people really want to know about or hear from me today is a little bit about our vaccination rates and our compliance rates. So I think this is really good news for those in classes that are face-to-face. We're at about an 87% vaccination rate, and that's what's been recorded. I want to mention that we continue to get vaccination cards coming in. So we have some stragglers coming in, but we are 87% in the classroom, and we are 80% overall when you take into account our online students. We are very concerned with creating a safe environment, right? So having compliance to the policy is really important to us. We are just about at 96% compliance to the policy for our in-person students. So we feel confident that when our students come to our campus to have a learning experience, they can focus on learning and not worry about their safety. To the extent possible, we are creating a very safe environment for them to learn in. We are asking a lot of questions about, or we're getting a lot of questions about, what does it look like if a student is not in compliance? And I think that's a really important question. I wanna lead by saying that we have a small army of about 30 people, maybe even a little higher at this point, who are on the phone every single day, calling students, asking them, how can we help you get there? Here are multiple pathways, which is the right pathway for you. And that work has resulted in us seeing that number of compliance go up and up and up and continue to go up. So as we speak, we have different folks from both student affairs and academic advising on the phone with students, emailing students, providing a last-ditch effort to get us there. I really want to thank so many people. We had 2 associate deans, faculty, staff calling last Friday. We called 1,000 students last Friday to talk with them and find out how we can help them get on the path to compliance. So it has been a full court press, and it has paid off, and it's continuing to pay off. Tomorrow is the last day in which students can share with us how they're getting on the pathway to compliance. So either submission of a vaccination record or in compliance through an exemption. So as I stated, we're at about 96% compliance. We think we will be higher when we get to that finish line. But for those who are not in compliance that have an in-person course, they will be removed from their in-person courses. So that's first and foremost. Most of our students are enrolled in a combination of online and in-person courses, so they would retain their online courses. So they would only be removed from those that are in person. We do have a few students who are enrolled exclusively in in-person classes, and we're working very hard to get all of those students in compliance. So they will get a notification next week if that's the case. They'll be able to work with their academic advisor to figure out pathways and how they might reorient their schedule for the winter term or do things like that if needed. So that's where we're at. And I think we have a lot to be proud of.
I agree. Thanks, Amy. That's great news. Great news. Okay, next I'll throw it over to our emergency management director, Laura Drabchek. Just on a few housekeeping details, there was an announcement that came out today about changes to the testing center. And I know there were quite a few questions that we received about when does the door screening stop? When do the doors open up to all the buildings? So Laura is prepared to talk about that. Laura.
Great, thank you, Ken. So first off, as of this week, we will wrap up daily weekly tests for the testing and vaccine clinic. Next week, we will move to testing and the vaccine clinic twice a week, which will be Tuesday and Wednesday from 7:30 a.m. till 6:30 p.m., both of those days. If there's a reason that someone can't make it to campus those days, we also have some home test kits that individuals can request. Those will be distributed through HR for faculty and staff and through the Interaction Hub at the University Center for Students. And we'll have more information coming out shortly as to how you can request one of those kits. As far as door screening goes, we're going to continue the door screening one more week through Friday of next week. There may be other exceptions. Library may continue a little bit further in a few other buildings. We just want to continue to evaluate the means of egress into those buildings and what those areas and traffic might look like. And as far as buildings opening up on campus, those doors will swing open to the campus community without screeners starting on Monday, September 27th, Ken.
Thank you. So Laura, one of the questions that we received, maybe this is appropriate time to answer it, is if there's in an office on campus, because we're not going to be looking for screens any longer after the 24th, but if someone on campus wants to see a student screen, they can ask for that, correct? Maybe an advising office if a student walks in to show their responsive blue?
Yes, they can ask for that, and to see that one check mark on there.
Thank you. Okay, we're going to go into the questions that we received quickly. There were some questions that were not related to COVID and the operation. We're going to save those to the end. We're going to go into the COVID planning ones first. So Amy, I'm going to go back to you. We have had a few COVID cases on campus since the semester started. Can you just remind faculty and staff what they should do if there are students that test positive? What are we doing in the classrooms in terms of quarantining and moving things remote? And what should faculty and staff do if they hear someone in the class does have COVID?
Absolutely. Thank you. So we have benefited from the quick action of faculty and staff, even just in the last 3 weeks, who are letting us know the minute they hear of something, even if it's a student reporting, hey, I had a cough this morning and I'm choosing not to come to campus. So that's the right thing to do, is to reach out to Dearborn COVID support at umich.edu or call the hotline at 313-593-5056 and just let us know what's going on. We will contact the student. We will get a sense of what's happening. We would do any appropriate contact tracing. If a student is COVID positive and they have been on campus within 48 hours prior to their symptoms beginning to demonstrate, we would be looking at a quarantine. So we reach out to the dean and often the chair and the instructor and work together to figure out the plan. So the CDC says that those who are both masked and vaccinated do not need to quarantine in the event that they are exposed to a COVID-19 positive person. However, those who are not vaccinated or not masked or both do need to quarantine. So we have a few of us have access to vaccination statuses so that we can quickly assess if there are students in the class who would need to quarantine. This is another reason why the 87% number of students in the classroom who are vaccinated is really important. That's going to keep our students in classes. So we will do that legwork. We will then reach out to all of the students with a call and with an email, and we will also communicate to all the students all the students' instructors, if they are quarantined, to let them know that this student has had to quarantine, that they're not just not coming to class, that they have a particular reason why they're not able to be there. We don't share personal health information. So we simply say that, they cannot be there. This is outside of their control. And this is similar to what we do, for example, when a family calls in and says a student's been in a car accident, right? And we communicate to faculty and we just say, if there's an opportunity to assist the student or provide grace, that would be appreciated. So we do all that work. We also share with the student when their either isolation or quarantine would expire, when they can come back to campus. We are tracking that to make sure they're not coming to campus. We have a set of auto-generated emails that we're working on now. So we really feel that we are keeping that in tight control to make sure we prioritize the safety of those who are still coming to campus. So in summary, anything going on in the classroom, please reach out to either myself or the COVID hotline or the COVID email, and we will get back to you promptly. And we will make sure that we are fully putting our effort into an urgent situation so that we can get it under control fast.
Thanks. I just want to clarify one of the questions that came in. We're not asking faculty or staff to turn in students. We're asking you to serve as our eyes and ears and answer questions should a student not know what to do. I mean, we've been bombarding them with constant email communications, but some of them aren't read and some of them aren't, for whatever reason. So we're just asking for help to direct students as to the appropriate action plan.
And students are calling us to report, I have a cough. I'm making a personal decision not to come to campus. So I think our entire community is each person is carrying their own responsibility here. And I think that's really exciting.
Question about building access outside of the Monday through Friday 9 to 5. There shouldn't be any reason why that will not happen after September 27th, correct? I guess I throw that to Carrie and Laura.
So I think there is no plan to lock faculty out of buildings. I think if you have an M card that gives you access to a given building in a given set of hours, that should still be functional. It should be functional as well after screening ends.
Can I just add something, Ken, because I know that I've heard some concerns from faculty members that we've had to do this to basically lock the buildings and the offices just because we wanted to make sure that we would have screeners on campus and at the buildings. If we didn't, then we wouldn't be able to have those buildings and office access for you. So it's really temporary, like Carrie said, they're going to be opened up just as usual. Thank you for your patience with this.
I guess sort of on a related topic, there's been a few questions about when can we stop wearing masks? And I know Domenico shared earlier, we're waiting for like the next surprise and the next twist and turn, but I don't know if, Laura, maybe you want to address, I don't believe there is any date set that we will remove masks on campus for the foreseeable future. Is that correct?
That is correct, Ken. I think, right now the science still tells us that, masks are one of the safest layers that we could have to protect not only ourselves, but others around us. So I don't see mask mandate going away anytime soon, but it is something that we will continue to watch and monitor and evaluate. And if we need to make a change, then we'll definitely do so.
And thank you to my panelists for helping answer some of the questions online. I appreciate that. Domenico, next question for you. Is there what trends or what data are you looking at in order to maybe make a decision to pivot the whole operation of the university online? We're not anticipating that at this today, but we don't know what the future holds. But if you can just share a little bit about what you're doing in terms of answering that question, keeping the campus safe.
Sure, Ken, and you're right. I hope we don't come to that, but we are in constant communication with our medical folks in Ann Arbor, Rob Ernst and Preeti Milani, and we monitor also the positivity rates locally and statewide. And I think there is no magic number that's going to be a trigger for us. We're going to be looking at trends. We're going to be looking at the positivity rates are among vaccinated, and if they're symptomatic, asymptomatic, how severe they are, what the hospitalization rates are, how the variants are going to be changing, the efficacy of the vaccines. So we're going to be considering all of these factors and monitoring them closely. And we do this virtually every day. And I get on the Michigan Health Department website and look at where our positivity rates are, and it's fluctuating around 10%, which is about twice as high as it was just a few months ago. So we are in a bit of an uptick. We're not as severe at all as many of the southern states. I think we're in a good place, but we have to be ever vigilant about how we protect ourselves. And if need be, we will pivot. But as I said, it's going to be a result of multiple factors that we're going to be considering. And there'll be a lot of conversations with the senior leadership about this.
I can attest to the fact that the chancellor is looking at many, many resources, any text and emails, everyone on this call and others frequently about trends. So it's helpful, and it really goes into informing what we do here on campus. So as much as we hate them, Domenico, thank you for doing that. Keeps us informed. Okay, next question maybe for Gabriella, maybe Domenico. The vaccination policy that we have in place, we see this continuing into the winter semester. One of the questions submitted is, our students may be staying remote because they think this policy is going to go away before the winter semester. Your thoughts on that question?
That is an excellent question. We really don't know. Like Amy said, We're literally making calls every day to students to try to help them, to try to understand why they're not in compliance. So we really don't know. And we're going to continue to understand in order to offer a better educational experience, in order to be able to address their concern, their personal concerns. Some of them we know they don't feel comfortable coming to campus, and that's why we had a good online amount of online classes. We were trying to have at about 70% on campus scheduled this fall, and it turns out that it's about 50%. So we know that students who wanted online classes at the beginning were able to get on online classes. So we're trying to understand the situation still. This is remember, this is the first semester we're back, the first 3 weeks. And so it's still uncharted territory.
Gabriella, I'll stay with you. There's a faculty question that came in. Individual feels a little unsafe in labs, having to work in close proximity with students in the classroom. Is that, if there's concerns about moving that class online, what should that person do?
That person should talk to their discipline rep and their chair and figure out a way to best deliver that lab. As we know, labs are hands-on. I actually talked to some of my natural sciences colleagues last semester and the semester before, who were very concerned because they said that students learn best in the lab, and actually students who go on to graduate school, medical school, they need a certain amount of time physically in the labs. So we did listen to those concerns, and that's why natural sciences did a great job. The department did a great job at scheduling what could be delivered online, and what had to be delivered on campus because of very sound pedagogical reasons on campus. So my advice is to go straight to the discipline rep and to the chair and have an open discussion about why you think your class should be online. And Amy reported on some great numbers, above 90%. I mean, this is a safe environment, and I feel that we need to continue to deliver what our students need as far as a learning experience.
And a similar, Laura, I'm going to quick question for you. Currently, there aren't any social distancing mandates that we need to follow. Is that correct?
That is correct, Ken. At this time, there are none.
And because we had a question that came in about why weren't larger classrooms considered for classes, because if they're dark and they can be used, did we look at that? And I believe it was not addressed because there aren't any social distancing requirements in place. Is that a fair statement?
That is a fair statement, Ken.
All right. Sorry. We're answering a lot of these. There's a question here about what are we doing to enforce mask mandates? There's been observations across campus where, particularly in the UC or the library, where masks are coming off if they're just sitting there and not eating. I know this topic came up in our return to campus meeting this morning. Amy, Carrie, anyone on that call? Laura, want to address that? I have some thoughts too, but
I can certainly start. So I can say that we're hearing that in the classroom, we have really good compliance with the mask policy. I think where it gets a little funny is in the university center, where people have the opportunity to purchase food, right? And as we know, when people are eating, they can pull their mask down. I think it's perfectly appropriate for students, faculty, and staff to mention to someone, if they see someone who isn't wearing their mask, that's clearly not engaged in the act of eating at a table in the food court, to say, hey, just a reminder, you don't have your mask on. In the times that I've done that, I've recognized quickly that the student didn't realize they had forgotten to put their mask back on, right? Oh, okay, let me get it back on. So they had it handy. It wasn't because they were intending to be non-compliant. So I think, just nicely asking folks to be compliant. I think we have an obligation to keep our community safe. And this is, as Laura said, probably the most important tool in our toolbox. I think that's a first step, is just asking them to comply.
In the meeting this morning, it was sort of compared to the smoking policy, where if you see someone smoking on campus, just to send a general reminder that it's not allowed here. I know could put people in an awkward situation, but I agree with Amy. I've been in many of these buildings, and a lot of times they just forget and the mask is in their pocket, and it's just some asking them. And there's been talk about putting additional signage up and just getting more in touch with, having people, other people, maybe on this call, going up to people to say, hey, just a reminder, put the mask on. But we've also made that observation as well. Question about the library. Gabriella, are there any plans to open it up to external audiences, people that are not affiliated with U of M-Dearborn?
That is certainly our hope, but for right now, we have no plans just because we're still evaluating the situation and seeing how it evolves. So we are, as you know, we have the mandate for our own community, so we're keeping it sort of tight because of that reason, but hopefully soon.
Amy, this question came up. It was the person referenced that in our local community, Dearborn Heights, there tends to be maybe a negative view on vaccinations. And are we doing anything to help educate the local audience? And I know that we, I don't know if this is inferring the Arab American population, in our local community. It doesn't say that, but I know that we did some, we had a healthcare provider that was on our campus for Wolverine Welcome Day, as well as the Student Org Day. That was, it was perfect timing, when they called and they said, I think they also noted this and they're reaching out to organizations in the area. But if you wanted to comment on that, maybe I commented too much, but go ahead.
Well, you stole what would have been my first point, but that's okay. And second to that would be that we've been referring students to free health advisors that are provided by the Ann Arbor campus, who can help talk with the student to understand what their concerns are, where they might be unsure, so that the student can make a better, more informed decision. My experience has been when you put information in front of the student, it really helps them to make a good decision. And in most cases, what we're hearing is after conversation with a health advisor, they are feeling like they want to get that vaccine. So definitely providing opportunities to educate students, putting information on our website as well. So there's lots of places where we're taking the opportunity to provide a little bit of extra education.
Thank you. And reason why I stole a little bit of your thunder is that call came into my office and I'm like,
did.
this sounds like a great idea. We should get them there. And they were able to be there the next day, when the call came in. So little background on that one. There was a question here about food service at the Fairlane Center. Vice Chancellor Brian Dady provided feedback for me to share. They are offering service midday for food to be ordered and delivered over to the Fairlane Center. They're closely monitoring this, and we realized that evening food service would be desirable. So he did share that, right now that sales for Picasso are a little bit lower than what was expected. And so there is a financial part of this equation, but he just wanted me to share with all of you that he's monitoring the situation and things may evolve as we move through the semester. And I believe there's some questions here about when our M card is going to be reactivated. I don't know if anyone on this call can answer that. I would assume on the 27th, but I made note of this because we are planning a communication next week to the campus to talk about things that are changing the week of the 27th. And I have this noted, and it will be communicated as soon as we know. So thank you for that question.
Yeah, I can just add a little bit there. Access that existed before the pandemic on your M card, unfortunately, was removed and can't be reinstated. So I believe there is some access being restored, for example, the building, that you work in. But generally, if there was special or additional access on M cards, it will have to get re-requested. That is my understanding from Carol, that has to be done. So you'd have to work with your DAC, your Department Access Coordinator, on that.
So it looks like someone's responding to the one question that we have open. Thank you. Please, if there's any questions, continue to put them in, but there are some topics that we received that were unrelated to COVID, which I guess is another positive sign that people are thinking about some other things. So I'm going to go into those questions now. And as I mentioned, just feel free to continue to ask questions about what we're doing. Gabriella, these next two are for you. Drop ad was yesterday, I believe. And
Yes.
As Amy mentioned that, tomorrow is the day that, we're going to work with students to move them online or possibly disenroll. Hopefully we don't have to go there, but any update you can give us on enrollment numbers?
Yes, well, I think that surprisingly, personally, I was surprised that enrollment numbers look good compared to what we thought they would be. So we are about 5% lower than previously thought, but FDX are up. And overall, I am very pleased with the numbers that we got this semester.
Typically do a story on this in the quarter, usually the week after. So I know my team will be working with Melissa.
Yes,
Yes.
definitely. Melissa is and her team, Melissa Stone and her team are constantly working on updating those numbers. So pretty soon after the add and drop and add period. And again, it's going to take a little longer because of the issues that we're having with calling students and making sure that they remain in our classes rather than just administratively drop. I want you to know we're doing everything possible to lose no student at all, no student left behind. But after that, we will release the numbers which will be the numbers for the semester.
I'll stay with you. There's a question here. What are we doing to collaborate more with Henry Ford College, right next door?
Well, that is a great question. We actually are, Domenico, our chancellor, and the president of Henry Ford College are working on an exciting initiative. Melissa Stone has been putting together a proposal. So I don't know if Chancellor Grasser, you're ready to say something, but I want you to know there's a great plan in place that we'll be able to announce as soon as we have all of the details.
Just to echo what Provost said, Russ Cavaluna, the president of Henry Ford College, and I have brought our teams together to look for more creative ways to facilitate a stronger and tighter relationship between the two. And we're looking at other models. The Northern Virginia Community College and George Mason University have a terrific exchange model there that we're looking for processes and procedures to help us. And we're looking at some other programs in the Philadelphia area as well. So we're looking across the country for best in class practices. And we're hopefully going to be announcing something in the very near future that's going to supercharge our relationship with them.
And it's nice to talk about something other than COVID, to strengthen enrollment and partnership. So that's
Indeed.
good that we wait. Good. Question here, Carrie. There was a question about Wi-Fi dropping in between buildings. And, I know I have witnessed students struggling, when they were trying to do the Response Blue app, when they didn't read any of the emails we sent over the summer. They were all huddled in the lobby areas of buildings. So I know that there's some good news that you can share about Wi-Fi across campus.
Yeah, we have an expansion effort out on campus to install pervasive outdoor Wi-Fi over the whole campus, including the parking lots, which I think will also be helpful for students who are trying to map their drives home and look at the traffic. So that is all wired up and ready to go. We're actually waiting for the access points to be delivered. Those were delayed because of the chip shortage, and we expect to get them installed in December, but I don't have a firm date on delivery yet. So if not in December, it should be early in the winter, and we'll sure get those up as soon as we get them because, like I said, we're ready to go on them.
Thank you. Gabrielle, I believe a question from a faculty member, about questioning budget for copying and student assistance for courses. What should they do?
Oh, I think you need to talk to your chair and then to your dean because they control their own budget. So I think that would be the best avenue right now. I wasn't aware of this, but please talk to them and then come back to me if you still need an answer, but they would be the best people to talk to.
And there were a few questions that came in about our MOU with the union across the street, the space leasing for offices and gathering spaces. I again checked with Brian Dady, and he mentioned that his office is reviewing the MOU. I honestly, I don't know when it expires, but it must be soon because we got about 3 or 4 questions about this, and he's working on that, and we'll share any additional information when it's available. Okay, just looking, there's a few questions. It just noted in some of the buildings, Carrie, maybe another question for you. It's not necessarily Wi-Fi access, but it's cell phones access to the internet, not using our own Wi-Fi.
Right, so cell signal on campus is not always great. And that has been a long time issue on campus. We are in the process of getting AT&T hardware installed on the campus tower, which should be done in the next weeks. I'm not exactly sure the timeline on that. That should significantly improve it for AT&T. And then in the future, I'm hoping that we'll be able to do something with at least Verizon as well. But the construction of the buildings, the LEED construction, the environmentally friendly construction techniques that are used in our newer buildings especially make it difficult for cell signal to penetrate the buildings. And so that, in addition to our kind of lower location right by the river, makes cell coverage difficult.
I learned something today. We always thought LEED certification was a good thing. And it is probably for most things, just not everything. So good. Okay, it looks like we've exhausted our questions. I don't see anything else coming in. I will, I guess, throw it to, and we're not used to this. We usually go for the full hour and can maybe go a little bit further. I guess, Domenico, would you like to, share a few closing remarks? And then I have a few things at the end I can share.
Sure, Ken. First, again, I want to thank you for being a gracious and informative host. I want to thank my team for the terrific information that they shared with everyone. And I just want to reiterate my extraordinary enthusiasm and optimism for the future of this semester. I think we have a great set of protocols in place. People are complying with them. We're keeping people safe. I see a lot of smiles on faces when I actually jar them from looking at their phone call, walking across campus, and I say hello to them. And I think that everybody is prepared for a terrific semester that I know we're going to have. So I want to thank all of you for the terrific effort that you've all expended. And if there's any way that you see that we can improve, please let us know, and we will certainly take that into consideration. So Ken, I'll turn it back over to you.
Just a couple, final thoughts. There are a lot of people on campus now. Like, I think all of us on this call are on campus. So we could have done this live, but we are in for future town halls, and even resurrecting the conversations with the chancellor that we had before the pandemic. We're looking at maybe doing the next one, a hybrid model, where the people that are on campus can come, sit together, and then we would have the Zoom and everything we needed up on the wall to engage people that are maybe still working remotely. So that's something that we're looking at doing. This is recorded. We are going to put this in Reporter on Tuesday. There's also going to be a summary. If you just want to read the highlights of this call, that will be in the Reporter on Tuesday. So thank you for my team on that. And yeah, I think that's it. Again, thank you, Kamal and Anitra. Obviously, I needed you with Maria not being with me. And I appreciate that. And I just do. I think we all thanked everyone on campus. I also want to thank people on campus. I personally, I was at a lot of doors helping with screening, and as all my colleagues were, and it was great seeing everyone and to see the effort over the last couple of weeks. I think that's what keeps all of us going, actually. It's a huge team effort. So.
Yep.
So good. We all have about 16 minutes of free time. That's outstanding. So thanks everyone. And we look forward to seeing you very soon. Have a great semester.
Thank you, everybody.
Bye-bye.
Thanks, Ken.